I want to welcome all of you here in Madison to today's event and those who are joining us virtually all across the country. My name is Leigh Mills. I'm one of the evening news anchors at NBC 15, coming up on 20 years here in just a few months. And it's my honor to be here today because, as I know in the stories I've covered over those 2 decades, the addiction crisis has harmed too many of our friends and families here in our state. So thank you for being here. We have an exciting announcement. You heard a little bit there in the video of a new first of its kind programming that will be available here in the state of Wisconsin. And I have a couple of statistics for those of you who aren't super familiar with the data, just to put this into perspective. More than 46 million Americans ages 12 and older currently live with a substance use disorder. The most recent full year of data is 2021. There were 1,427 deaths in Wisconsin due to opioids. And we know with the fentanyl crisis that those numbers have really been going up in the last 2 years. So here today, this is a resource we are going to learn more about that will help people who are struggling. We have a number of speakers, as you can see up here to my left. So let me just quickly mention who we will be hearing from today. We have State Senator Devin LeMahieu. We have our State Attorney General, Josh Kaul. We have my friend, you know Tom Farley probably very well. We have the Department of Health Services Secretary, Kirsten Johnson. And then we have a woman I just met today and look forward to hearing from, Jenny Hallett, who is a community member and has a personal story to share with us. And of course, we have the man in the video whom we just heard from, Gary Mendell of Shatterproof. He is the reason this resource is here today, and we are going to begin by hearing from him. He was going to be here, but weather issues created a problem for his travel. So we are going to be watching him here on the screen to give his remarks. For the founder of Shatterproof, we have Gary Mendell.
I just want to just say how much I appreciate the opportunity to be here with all of you. We greatly at Shatterproof appreciate the bipartisan support of the legislature to include funding for Atlas in the opioid settlement plan that was passed 2 weeks ago. I also want to acknowledge Senator Majority LeMahieu and Senator Felkowski for their attendance and their leadership in supporting Atlas throughout this process. Thank you also to Jenny McClure, Chief of Staff for Majority Leader LeMahieu, for attending, and thank you for your long-standing support for this cause. I remember working with you several years ago when we started in Wisconsin. And thank you, Attorney General Paul Kaul, for your work on the settlement agreement. Thank you also, Secretary Kirsten Johnson, for being here and for our partnership. I also want to thank Senator Zimmerman for your support. Unfortunately, he couldn't be here today. And also a big thank you to the Foley team for hosting this event. Shatterproof's success depends on the strength of our partnerships. It's not about what we do, it's about working with others. In Wisconsin, we've had support from many critical partners who have helped spread awareness of our initiatives and make this happen. Many of you who I just mentioned. We are grateful to our phenomenal partners who have made this happen to help all families in Wisconsin. Thank you. I would also like to thank Wisconsin's treatment providers who have recognized the importance of what we are doing and who took the time to help us. Help us by providing detailed information that is listed on Atlas, and also help us by providing valuable feedback and their recommendations on how to make Atlas better, more efficient, and more helpful to the families in Wisconsin. Thank you so much to treatment programs in Wisconsin. And while Shatterproof is the convener, it is the community-based organizations and healthcare providers that are our facilitators and our mobilizers. From the state, health insurance, treatment programs, and so many others, thank you. As background, and you saw some of it in the video you just watched. Before founding Shatterproof, my career was not in healthcare nor nonprofit work. I had my own business and I was growing it and raising my family in a small town in Connecticut. And at that time, I'd like to talk about two boys. The first was Mikey, who was diagnosed with cancer. Two boys, actually, that were in high school. The first was Mikey, who was diagnosed with cancer. And as you'd expect, his family was easily able to access the highest quality, most appropriate health care for their son. Their parents told our community and our town about what Mikey was struggling with, and our community rallied behind Mikey and his family. Parents drove carpools, cooked meals. The kids in our elementary school held bake sales on the weekends for Mikey and his family. For Mikey and his new charity for cancer research. And the whole time Mikey was sick, he received all the love and support that anyone with a disease could ever dream of. Well, 2 streets away, Mikey's friend, my son, was also dealing with a disease. But for Brian, my son Brian, and our family, it was so different. We looked for medical care for our son that was most appropriate level of care, what he needed, and treatment that was based on science-based protocols. But unlike Mikey, we had no idea how to find it. Unlike Mikey's parents, I didn't tell too many of our friends what we were struggling with because I was ashamed as a father. I didn't view my son as having a disease, and I felt ashamed. And for our family, there were no carpools. There were no meals delivered to our home. But most important, when Mikey came home to visit from his treatment to our town back home, he felt a welcoming community. When my son came back home from his treatment, he just got silence. Well, both boys had developed their disease while they were in high school. And my son fought his disease for 8 years. But as I just mentioned, we had no idea what to look for treatment. Did Brian need outpatient or did he need residential? Did he need mental health services? Did he need medications? We had no idea. Which treatment programs were following evidence-based protocols recommended by our Health and Human Services, and which ones weren't? So over 8 years, we struggled, and Brian fought his hardest. I remember him visiting at a treatment program once in Florida, and I walked into his bedroom early one morning. It was 7 o'clock in the morning, and as he heard me come into the room, he looked up at me with this big smile of his and said, "Dad, don't worry. I got this." But addiction always doesn't work that way. On October 20th, 2011, I was woken up in the middle of the night by my cell phone ringing. And when I picked it up, I was told that my son had just died. He was 25 years old, and he hadn't used a substance in 13 months. And equally tragic, it wasn't just addiction that took my son's life. It was the feeling of shame he had every morning when he opened his eyes, of all day long feeling like an outcast, that caused him to wake up that morning, research suicide notes, write a note of his own, and take his own life alone. In the weeks that followed, I began to focus on 2 questions. What could I have done differently as a father? And having to accept what had happened, what could be done to spare other families of the tragedy that our family had suffered? I took 3 months away, what I thought would be 3 months away from my business, and traveled the country talking to experts in states all across the country and federal agencies to try to answer those two questions. And I learned a lot in those 3 months, but there was one thing that rose above it all. I learned that there was billions of tens of billions of dollars of research that had been funded, that had proven without any doubt through randomly controlled trials to be able to prevent many of our loved ones from developing this disease. And for those that had developed this disease, research that had proven, again, without any doubt, to be able to significantly improve outcomes for those in treatment. Yet all this information was buried in medical journals, and hardly any of it was being implemented. As a father, it destroyed me, learning about information that could have saved my son's life by either through prevention or treatment, and literally millions of others. If I'd only known about it. But answering that second question, what could be done to spare other families of this tragedy? The answer was clear. Form a national organization, a well-funded national nonprofit with no special interest. The only mission was to save lives. And lift this information out of the medical journals and work to get it implemented through forming partnerships. That was a vision. And that vision led me to leaving my business, spending a year and a half developing a business plan with the experts that I had met in those first 3 months. And we launched Shatterproof 9.5 years ago. Our first major initiative was working to transform and elevate the treatment program in the United States. Number one national standard of care that was all based on science. That's our national principles of care. Then, those looking for treatment, do they need outpatient or residential, as I mentioned earlier? Do they need medications, mental health services, as I mentioned earlier? Well, we approached the American Society of Addiction Medicine, who has the gold standard in that assessment, and to work with them to create a consumer-friendly, less than 15 questions, less than 10 minutes assessment that those looking for treatment or families looking for treatment for a loved one could answer to determine those two questions: outpatient or residential, and what additional services, clinical services might they need, whether it's mental health services, medications, or others. And we worked on that for a year and a half. That was completed in June of 2020. Next, quality measurement system. If you know you need outpatient or residential, and you know what services you need, whether it's medications or other, how do I find a provider that is following evidence-based practices versus those that aren't? And most appropriate by other filters, by age, by location, whether they're serving veterans or not, et cetera. So we developed a business plan to build a quality measurement system. And that's why we're here today. We built it over 2 years with $5 million in funding mostly from philanthropy, to pilot it in 6 states to see if it would work. And it launched a month after the assessment was launched with the American Society of Addiction Medicine, and we put the two together on one resource for families, Atlas, Shatterproof Treatment Atlas. It's all free for families, and it launched in 6 states, representing 13% of the United States population. I'm thrilled to say that last year we grew to 10 states, representing 28% of the United States population. I'm thrilled to say that 2 months ago, we launched in California, taking it to 40% of the United States population. And today, with Wisconsin, we're growing over 41% of the United States population, and we'll be in 45% in the next few months. And next year, we'll be at well more than half the states, representing more than half of the United States population. I'm just so thrilled to be here announcing this in Wisconsin for the families of Wisconsin today. I want to say again that I just can't thank you all enough. This is just so needed. It's not rocket science. It's lifting the research out of the medical journals and putting it into action, implementing it for the families of those searching for treatment, and starting today through the vision of legislators and providers and health insurers and all of you here today. It's here for the families of Wisconsin. In closing, we are all responsible, whether we're impacted or not, to address this major public health crisis impacting our communities. I encourage you, please visit treatmentatlas.org to learn more. Thank you all so very, very much from the bottom of my heart. Thank you.
And we're going to give about 10 seconds just to, from Zoom back to those of us here in person. But a huge thank you to Gary for sharing not only the mission of Shatterproof, but his personal story, which, while certainly tragic, is very compelling to see how it motivated him to try to make a difference for others. So it gives me a little bit of hope that maybe we can see some outcomes turn around for those still struggling right now here in Wisconsin. And we're going to go through our speakers. So the next speaker I would like to introduce is the DHS Secretary, Kirsten Johnson.
Thank you, Leigh. And thank you, Gary, for sharing your story and for being the founder of Shatterproof. Good morning, everyone. We're thrilled to be here today to recognize the launch of Atlas, a life-saving tool that will connect those struggling with substance use disorder to get the treatment they need when and where they need it. Thank you to Shatterproof and Farley for hosting this event to bring us together, to unite us in our efforts to help Wisconsinites and their families and friends and those who love them locate quality care for treatment. I want to tell a quick story. I first started working in this space in 2012, and we hosted, at the time it was an opiate, I don't remember what we called it, but it was like an opiate forum in Ozaukee County. And it was attended by almost 1,000 people. And afterwards, a mom came up to me and told me the story about her daughter. Her daughter was in high school, had done some artwork. It had alarmed her art teacher. Her art teacher called the mom, gave her the piece of artwork and said, "I'm very concerned about your daughter. I'm concerned she's using a substance." And the mom said, "Absolutely not my daughter. This would never happen." So you think about the shame and the stigma and also not knowing where to go. And she actually gave me the painting that her daughter had painted. And I keep it in my office as a reminder because it is so stark and so dark and so clearly a cry for help that even a mother who loves her daughter deeply and is very, clearly cares about their mental health was in a place where she didn't know what to do, and she really couldn't believe it that this was happening to her and her family. So again, if this is bringing Shatterproof to Wisconsin is going to help families just like this woman and her daughter and all of you here who have unfortunately suffered losses that I can't even begin to comprehend. But this is so critical. Atlas is a free online platform that's being added to Wisconsin tools to support access to substance use treatment. In public health, this is something we've been talking about for years, of how do we collaborate, how do we bring people together, how do we assure that we can get people the access and the resources they need right when they need them, not having to make 16 different phone calls to figure out who to call, what they need, what's most appropriate, what their insurance might cover or not cover. And Shatterproof really is bringing all of those things together. So I thank you to the legislature for funding this for the next year, and also thank you for all of you for your advocacy for the Atlas tool. Implementing this platform will also bring other tools like our longstanding Wisconsin Addiction Recovery Hotline, which is managed by 211 Wisconsin, and bringing all these things together so we have a broader list of choices for families. Atlas provides location, comparison, and review of treatment programs in the state. And I know at the end of this we're going to go through it, but I was on it last night and it really is exceptional. You can search and filter by a number of different things that you potentially need. It includes information about the types of substance use treatment services provider or facility offers, age-specific resources, substance-specific resources, and insurance and other accepted forms of payment. We encourage those who have received services to leave feedback. Again, critically important is that other families can feel connected and know what it is they may be receiving. So can leave their feedback through the patient experience survey to share their reviews, information about their experience, and how they felt about the treatment services that were offered by the provider. Being able to find access and access treatment provides the path to recovery for those who need it most. Recovery is a lifelong process. It requires long-term support for individuals and families. Which is why I'm very pleased to share the Wisconsin Department of Health Services plans to fund Shatterproof with an additional $300,000 through the opiate settlement funds. Again, thank you to the legislature. And we are really looking forward to our continued partnership as we move forward with Shatterproof to protect and promote the health and safety of Wisconsinites. The pain of substance use disorder affects us all, our communities, our families, and our loved ones. And it takes all of us to ensure that those who need help can access it easily. Thank you.
Our next speaker is State Senator Devin LeMahieu.
Well, good morning, everybody. It's great to be here this morning with the rollout of Atlas. I'll keep my comments incredibly brief since I'm probably the least qualified person of this panel to speak on this topic, but it's truly an honor just to be a small part of the legislative process to get so many important legislative bills passed throughout the last decade. That all received incredible bipartisan support, starting off with the HOPE agenda back in 2013 through 2017, which was championed by former Representative John Nygren, to the opioid settlement, and not just in substance abuse, which affects every corner of the state, families all across the state from rural to urban, especially highlighted during the pandemic when people were sort of left alone and not socializing in public, but also the mental health issues that we've highlighted over the last decade, many different mental health bills, because so many times substance abuse and mental health go hand in hand. So it's just great to see a program like Atlas being rolled out in Wisconsin, so hopefully families can find the help and support that they need when the future looks very bleak to them. So it's great to be here, and just happy to be a small part of getting important legislation across the finish line to help families when they need it the most. So thank you.
And our next speaker is Wisconsin Attorney General Josh Kaul.
Good morning, everybody. First, thank you to everybody who's here. Thank you to the organizers of this event in particular. And thank you especially to everybody around the state and the country who is working to address the opioid epidemic and substance use disorder. It's great to be here to talk about this vitally important topic and to be celebrating a significant step forward in our efforts to address substance use disorder in Wisconsin. At the Department of Justice, fighting the opioid epidemic is a major priority of ours. This is an issue that impacts people in every corner of the state of Wisconsin and really in every corner of the country. It's an issue that has devastated lives, both for people who are struggling with substance use disorder, but also for family members and friends who are struggling, trying to figure out how best to support a loved one who's dealing with substance use disorder. At the Department of Justice, we are approaching this issue with three main goals in mind. One of them is accountability. Accountability for drug traffickers who are distributing the most dangerous drugs. Accountability for pharmaceutical companies for their role in the opioid epidemic. We are also working to promote prevention, to reduce people becoming addicted to substances like heroin and fentanyl and other dangerous drugs. And then we're working to promote treatment and recovery services so that we can help people who are struggling with substance use disorder. Now, over the last several years, we have helped to secure hundreds of millions of dollars in recoveries as a result of the opioid investigations. Those resources create an opportunity to fundamentally transform our response to the opioid epidemic in Wisconsin. And we need to have that kind of transformative response, because as bad as the opioid epidemic was just a few years ago, we're now dealing with two challenges that have really exacerbated the challenges that we face. One of them is the impact of the pandemic. It's impacted people's lives in so many different ways, but one of them is that the isolation that went with it has led to an increase in a number of challenges, including substance use disorder. We are still dealing with the impacts of that pandemic. Secondly is the rise in prevalence of fentanyl. Increasingly, we are seeing overdose deaths that are caused specifically by fentanyl. Increasingly, we're seeing narcotics that have fentanyl mixed in, and even at a very small quantity, that fentanyl can be deadly. It is as important now as it's ever been, in fact, more important than it's ever been, for folks who are struggling with substance use disorder of any kind to get into treatment programs and get support now, because the odds that somebody will inadvertently or intentionally take fentanyl that could take their lives is higher now than it has ever been. So programs like this that make treatment accessible are really critical. As anybody who has navigated our healthcare system knows, it can be a challenging system to navigate in any circumstances. But when you add in the stigma and the challenges of finding treatment providers for folks struggling with substance use disorder, that challenge is magnified. Programs like this can help people navigate that challenge successfully and get connected with the treatment that they need to help address substance use disorder. So it's a privilege to be here talking about this. I look forward to seeing more efforts like this to invest in treatment and recovery programs, and we look forward to collaborating with many of the folks here as we continue moving forward and working to address the opioid epidemic. So thank you.
Our next speaker is a New York Times best-selling author, founder of the Chris Farley Foundation, hilarious, and my friend Tom Farley.
Okay, yeah, I stopped writing my notes on my hand recently, so let's see what we got here. Yes, well, 25 years ago, this last December actually, I was sitting in a friend's office where I lived out in Fairfield, Connecticut, and we were discussing he had some entertainment industry experience, and we were trying to come up with some kind of fun project that we could include my little brother Christopher in. We had just finished 5 years on SNL. And he had a TV next to him that he always had in his office, and it was kind of muted, but he always had CNN playing. And in the middle of our conversation, out of the corner of my eye, I saw like some clip of Chris, and I glanced over and they were showing some clip. It was him and David Spade, some movie thing. And I thought to myself, oh, what's he up to? I hadn't seen him in about a month and a half. They had been in New York, and I went to turn up the volume. And just when they did that, the screen switched to his apartment in Chicago, the John Hancock building with an ambulance out front, and the anchor is saying that we just heard that the comedian Chris Farley had died. And I was like, I at that point I was like, one of the first things I remember thinking was like, how do I process this? How do I such a public, there it was, this family disease out there out front. And I thought to myself, I'll never be able to talk to anybody about this. I'll have to deal with this on my own for because this is so I was so unique. And I realized in the months since very quickly that I wasn't so unique. I actually shared this loss and this grief with a lot of people. And in the 25 years since, that number has just grown. exponentially. And the drug that killed Chris, I thought, what could possibly be worse than heroin? Well, here we are 25 years later, and we did, there are drugs killing at a much higher rate. So, the first thing I did, like a lot of families here today and throughout the country, I did what, the first thing I could think of was I needed to go out and tell Chris's story and talk to kids, his fan base and the communities. But it was really a means to just deal with my own grief. And I started to address that, and I realized that I was going down this path, and I was actually helping people. I was starting to make a difference, and it felt good. It definitely was helping with my grief, and I didn't feel so alone anymore. Unfortunately, I've met so many, wonderful people and families with their foundations that have kind of done the same thing I had done. So I did that, and then I moved back here to Wisconsin, which really felt telling our story here to my tribe, to the people that I knew that I kind of grew up with and grew up in the same environments I grew up with. That felt right too. So I started out talking in prevention kind of terms, and eventually got more and more into treatment and recovery. And in that process, found recovery myself, which was amazing. I didn't see that one coming. I should have actually, and then I started talking about my story, and people started responding to that. Just being vocal about and just kind of getting beyond, that shame, whether it was about me or my family or this, I just felt like this is right. And people started responding to that. And they started responding to my story. I'm like, you don't want to hear about Chris? And they go, yeah, that's interesting. That's fun. But you're here, your story is that much more impactful. So, and then COVID started. And I did what I always did. I continued my advocacy work. And I partnered up with Hazleton, and we started doing webinars talking about this coming crisis. This post-COVID, what's happening? People are going to be leaving COVID with behaviors they didn't have going in. That we had an epidemic before this pandemic. What's going to happen then? And the more I heard myself talking about it, I said to myself, I got to do more than just advocate and talk. I need to get people into treatment. And now here I found myself in this treatment field and getting people the help they needed. So this is just one more step in that process. I'm finding, gaps in service. I'm trying to look, as I do, try to find, ways that we can keep pushing forward. One of the things I talk about is especially when I talk about recovery is I talk about this gateway that when somebody's in recovery or family is, they do all this research, they do all this work, and they get right to that last step, and it just becomes too hard. I can't go any further. I don't, the rest of my life, I can't, I don't want to do it. And what I tell people is, what's on the other side of that gateway is the same pain, the same hardship. It's life. You're not going to avoid pain by not taking that last step, but what's on the other side of that is a life that does get better. It was never going to get better before. I experienced that. And so I keep telling people that hope and recovery is just on the other side of fear. It's just on the other side of the stigma. And this Shatterproof, this is the kind of thing that gets us through that. And it's very exciting about that. It helps us bridge that fear. And we talk so much about these diseases, as diseases of isolation, and they certainly are. Mental illness, substance abuse, addiction. Yeah, they not only do they put the individual in isolation, but they put families in isolation, communities in isolation. And so we know that, and we work on that. But what I like to talk about is the flip side of that coin is that we cannot heal in isolation. It takes connection. It takes understanding. It takes knowledge and research. And again, this is what we need to do to break down those stigmas. And you know, one of the things, one of my more recent kind of themes that I talk about, certainly here in Wisconsin, you know, it's been wonderful that to my family that this state that we love embraced Chris. They remember him and love his memory and his humor. That's been very helpful for us. But here's the thing. We cannot continue to perpetuate the stigma of the disease that he died from. You can't love Chris Farley and still laugh about this culture that we have in the States. We need to do something about that. You can't have it both ways anymore, you know, because that's killing us. I talk about how in my own family, a year after Chris died, my dad died. You know, and again, and a lot of, you know, he was an unhealthy person, but a lot of it because of drinking. And all of a sudden, we lost these two just, you know, personalities in my family. Now we're still the Farleys. We still have fun. We still get together, and but it's a little different. And I look at how we are, and I look at this state that we love. Wisconsin is just an amazing place. It's one of the most beautiful states in the Midwest, if not the country. Our people are the hardest working, the strongest values, work ethic, all these great assets. But if we don't pay attention to these things in this culture, it's going to change. Not a lot. But it's going to be. We're going to notice it, just like I noticed it in my family. There's something missing. And there shouldn't be, because we can work on this. So that's kind of my message is how important this is. Yeah, we'll always be Wisconsin, and that's going to be a wonderful thing. But it is going to change us if we don't, you know, kind of make the steps to change. And again, it's just going to make us better. I am truly grateful for. You know, Shatterproof and what this brings to our state. It's amazing. It's going to connect us. It's going to get, you know, people into the right treatment, the right places, and it's going to eliminate fear. There's just nothing worse, whether it's an individual or family, just not knowing what to do. You know, and that's the first step is gaining that knowledge, but also just knowing that you're not alone. You're not in isolation. That's another thing that these kind of efforts do, is they eliminate that feeling of you're not alone. You know, there's a lot of people getting help, and one thing I tell to even the clinicians that are working to get people through treatment and healthy, I tell them, never forget what you're doing, you know, what's coming out the other end. There's nothing like the sight of a healed human. And we need, you know, to see people like that walking around, like me, in recovery amongst us. You know, we're valuable people. And you know, that's going to break down the stigma too. And this is just the step, you know, first step. So again, truly grateful for Shatterproof. I'm truly grateful for, if there's any state that's going to do this, it's ours, no question. So it's great to, you know, that we have this now, an opportunity to be this model, as we always are. So thank you for being here and allowing me to be a part of it. Thanks.
Tom, thanks. And I just want to say, I don't know that this has come up between us. I'm so sorry for the way you learned about Chris's death. And as a member of the media, we certainly in the last decade have been working hard to be more thoughtful about how our reporting impacts victims and their families. So I just want to say, yeah, right. I'm sorry. It's a terrible way for that to unfold. Okay, our final speaker before we get to our Q&A section. So if you're sitting here and have any questions, just know that we are going to get to those very shortly. But our final speaker is Jenny Hallett, and she is a Shatterproof ambassador and founder of Brittany's Alcoholism Training and Prevention, who is here to share her personal journey with us.
Hi, everyone. I'm very honored to be here today. On November 5th, 2014, I came home to find my loving 26-year-old daughter, Brittany Rose Hallett, dead in her bed when she lost her battle with the brain disease of alcohol addiction. And here's a photo of her. She was 26. And I have a little bit of her with me today. It crushed my soul and changed who I am forever. Brittany was a beautiful, loving, family-oriented person. She was a straight-A student her entire life because of her own drive. If not for addiction, she could have done anything that she set her mind to doing. She dreamed of getting married and having children, and I'll never be able to go to her wedding or hold her kids in my arms. She drank alcohol just like every other kid around her, but the effects of alcohol affected her body differently than most of them. Just like some people can die from bee stings, and while the rest of us are just fine, alcohol can affect people very differently from the next person. Alcohol took her down with a vengeance in just a couple of years. It was horrifying to witness my daughter slowly dying in front of my eyes. I advocate for people with addiction to alcohol and all other drugs because addiction is addiction no matter the substance. I even saved a young stranger's life with naloxone just 9 days after getting trained in how to use it. And it was one of the most miraculous things I've ever witnessed in my life. I ask everyone to bring back AOTA, which is alcohol and other drug addiction, whenever speaking to the media or advocating for new laws and funding to help people with addiction. Please specify that it is also for those with alcohol addiction because most people don't think of alcohol as a drug. People with alcohol addiction have become the forgotten ones, even though 100,000 alcohol-related deaths happen every year. So please don't forget people like my daughter. Every time I had to call an ambulance, I begged the first responders to just tell me where I can send her to get help. I'll sign the papers right now. Her family doctor didn't offer any advice. He just handed her some brochures for the local hospital programs that were around. So when a parent is first coming to terms with their child having addiction, they're reeling with so many emotions. It's hard to focus on anything but trying to save your child's life. And that is even harder when your child's an adult because of privacy laws. I had no way of knowing where I should send her, what type of treatment she needed, and what we should be looking for. I didn't know where to find reputable providers. I had no one to guide me in what I should do to try and help her. I wish one of those first responders or her doctor could have pointed me to Atlas. It's a great place to learn about best practices to look for, and then to find reputable providers that can actually offer the specific treatment to help save your child's life. When I watched the original Atlas launch, I begged Shatterproof to bring it to Wisconsin. I was honored to write to our legislators to express how important this valuable resource is for saving lives. I thank each one of them for listening to my pleas. When I heard that Atlas was coming to Wisconsin, I actually broke down and cried because I knew that now the next parent will have a valuable resource to help them save their child's life. Sorry, I get a little emotional. According to neuroscientist Dr. Stephen Dewey, who has studied the effects of different drugs on the human brain for decades using PET scan imaging, he says addiction can be detected by a PET scan image. You couldn't do that if it were just a simple choice anymore. And Shatterproof has actually contacted him as a valuable resource. My daughter used to say that she drank to feel normal again. Dr. Dewey explains the science of why she felt that way. Once a person is actually addicted to alcohol, their metabolic rate is changed for the rest of their life. But now, when they drink the very drug that got them addicted in the first place, alcohol, now that alcohol brings their metabolic rate back up to show a PET scan image with a normal PET scan metabolic rate. You can find the video I'm talking about, Dr. Stephen Dewey, on my Facebook page that can be accessed through my website, brittnysacap.com, which is BRITTANYSACAP.com. And I have flyers that have that information as well. A person with addiction is just trying to find a way to feel normal again. It's hard to say what any of us would do to get our hands on something that would finally give us a brief respite from the agony by consuming the drug that can make us feel normal, if not just for a few moments of merciful relief. It's horrible to watch a loved one go through that, which is why Atlas is such an important resource to help people find providers that can help them get into recovery. Thank you, Shatterproof, and all of our legislators, and every single person that helped to bring Atlas to Wisconsin. I know it will save many, many lives, and it will give much peace to all of their loved ones, because addiction truly is a family disease. I'm honored to have played a small role in bringing the life-saving resource to Wisconsin. This is Brittany's legacy. I love you forever, sweet pea, Brittany Rose. Thank you.
Okay, we are ready to take questions. You can see our panelists all have microphones, so if anyone here in the room has a question, feel free to raise your hand, or anyone who is watching online from across the country, if you have a question, you can type it in, and we have a way of getting that to me so that I can repeat your question and we can make sure that we are answering those appropriately. Yes, Michelle.
Where do we direct people? What's the website where they can access this, and is it available right now?
Who you want me to answer that? The website is treatmentatlas.org, and it is live now. Kirsten, you said you went on it last night. Okay.
And I searched it different.
We'll all put that on our Facebook posts later today, Michelle. Yeah. Yes.
How would a treatment provider get on the website if they offer some services?
We need a Shatterproof person up here. How would a treatment provider get on this resource? Is there a way to go about requesting to be included?
Yes. So we have a list of all licensed providers in Wisconsin. We outreach them all, inviting them all to submit data so that it can be shown on our website. And if anyone needs more information on that, we can take down their information and reach out to them. But we do reach out to all licensed providers and invite them.
And she will be doing the training later, so we will be hearing more from her shortly. Any other questions? Yes.
Part of the highly successful HOPE model
bill that Senator LeMahieu talked about was a significant investment in resources for treatment courts in Wisconsin. One of the obstacles sometimes can be access to treatment resources. So I'm wondering if one of the panelists can talk about how they see the connection between the Treatment Atlas and treatment courts working.
Take that as a side.
Yes, sounds good.
Great. Thank you, Adam. Well, first, a couple thoughts. You're absolutely right, of course, that one of the challenges that treatment programs face is that they only work if there is treatment that's available to people who want to participate in treatment. Right now, we have 56 counties, as well as some tribal nations that have treatment court programs that are funded through the Treatment Alternatives and Diversion Program. My hope is that we will see all participants in the justice system make sure that there's knowledge about these resources among judges, among defense lawyers, and among prosecutors, that we can connect as many people as possible with treatment services. And those who don't know, Adam is with the Public Defender's Office. We certainly look forward to working with your office and other offices around the state to make sure that folks are aware of this resource.
Any other questions? Are we getting any questions online?
We are good.
Okay. Anything else?
Yeah, actually, I want to just hear myself talk. But to follow up on that question from Adam, I just realized I am just kind of made a couple speaking opportunities I'm coming up in September at correctional institutions around Wisconsin. We'll see in Oshkosh and Redgate, and talking to inmates, and one of the, a lot of messages about recovery and things like that, but one of the things is people coming out of the system. This would be another, a resource to, like, it's not over, your treatment and your recovery is continuing even outside of the system, and this is a great step for them to transition. So I'm looking forward to speaking about this a lot more in those environments too, as well as to the staff of the institutions knowing about this and being able to talk about it even as they leave the system. So this is another great way that this is going to help.
Any final question before we transition? Oh, yeah, and it is after 10 to, go ahead.
Just was wondering, and maybe after I look at the tool, I will know, but is there any way to also provide a resource for where folks can find Narcan? As Jenny shared, she was able to save a life so that person can go on to receive treatment, and a lot of times that is the most important piece in getting from A to B with folks. Is that something that will be available on the tool where you can locate those resources, or?
So the question is, and would you mind one of you answer it? So the question is, will resources be available on the Atlas tool site to help people locate where they can get Narcan training?
Hi again, I'm Heather Lober, and I'm with Atlas. I'm the VP of State Engagement. Thank you for your question. So every facility that submits information to us has a narrative box where they can write all about the services that they offer, and that's a place where they can list offerings like that. We have another question from online, and I think it is, how easy is it for providers to help patients learn to navigate Atlas? Okay, yeah. So we do lots of trainings for community organizations. We're happy to do trainings for, say, discharge staff at facilities, other organizations like peer organizations, 211, those kinds of things. So everybody is well trained in how to help others use the tool. But it would be very user-friendly and easy for somebody at a provider treatment facility to help a patient learn to use this, or for the discharge staff to even use the tool to find the next level of care for somebody.
I have a comment on the Narcan question. So So DHS and through the opiate litigation funds, we have invested quite a bit of money in purchasing Narcan and making it available through local public health departments and also through sheriffs and police departments. So I would recommend just Googling your local health department. They likely have some Narcan trainings. And ideally we would have it all centralized in one place, but they are more readily available, and Narcan is also available in Wisconsin.
Okay, we are over time, so we are going to wrap this up. I want to thank all of you for joining us here today in person, joining us online from wherever you are currently today. I want to thank all of our panelists for being here to help explain the importance of Shatterproof Treatment Atlas, and the training will begin promptly. Have a wonderful rest of the day.
Yeah, let's go ahead and get started with the training and demo. All right, hi again. I'm Heather Lober, the VP of State Engagement for Treatment Atlas, and we're going to start the training component and the demo. Thank you again for having us here. We're thrilled to be launching in Wisconsin. I'm always happy when we go into a new state and for the services we provide. This is especially near and dear to my heart because I'm a Wisconsinite, so happy to be here. So we'll talk a little bit about Shatterproof and Atlas. So Atlas is part of Shatterproof, but we do lots of things at Shatterproof. And we'll talk about the current work we're doing and then launch into a demo. I think we all know from, just living here, the day and age that we're in, our friends and family members that have been affected, this really is the time for more intervention, more services to really help curb this epidemic. Shatterproof has a mission to help people struggling with substance use disorder and their loved ones. And really our mission is to help so that no one else dies from this disease. We'll talk about a variety of ways that we help. So we help provide guidance to people struggling with substance use disorder and their loved ones. We help inform about the treatment that's available. We also help educate the community, and kind of behind the scenes, we have a whole team of folks helping to impact policy and decisions that are made that directly impact people struggling with SUD and their loved ones. So we do lots of things here at Shatterproof. So when we talk about impacting the treatment system, that's really the work that we do with Treatment Atlas, and we'll get more into that in a minute. We also have a whole team of professionals that help reduce stigma in different parts of the country, and that's really important work to us. We do know that substance use disorder is a disease. It is not a moral failing. It's not a character flaw. It's a disease, and we really are invested in helping to reduce or eradicate stigma and really help the world see people struggling with SUD as people struggling with disease. We wouldn't ostracize somebody dealing with cancer or diabetes. And so in that same fashion, we want to really be mindful that this is a disease, and we know that now, not a moral failing. And then we do a lot of education in communities. So those are some of the different things that we do here at Shatterproof. So let's talk more about Treatment Atlas, the part that we're launching in Wisconsin today. So this is a treatment locator, and it is free to the public. It's in English and Spanish. It's totally anonymous. People can search for help with total anonymity. It is not a pay-to-play product, so providers can't pay us a certain amount or pay us more than the next to be higher on our search function. This is for every substance use treatment facility that's licensed in the state. They're all listed, so it's fair across the board. And we also have educational content, and that's something we put out there to encourage people that are struggling with SUD and encourage their loved ones. We also have password-protected portals. That's kind of the back end of Atlas. So the front-facing portion is to help human beings as they're looking for help or their loved ones. On the back end, we have password-protected portals for different groups. So one is for the state. The state has a portal to see the whole landscape in Wisconsin. They can see all of the best practices offered or the gaps in care across the state. And our hope is that by looking at this, the state can improve care offerings where needed, offer more levels of care in places where maybe there is a problem in terms of accessing that type of care. And then every provider who submits data to us gets a password-protected portal, and they can see how they compare with all of their quality metrics to the rest of the providers in the state. Again, our hope is that by looking at their data, they can see, well, maybe they need to offer more medication-assisted treatment in that geo area, or maybe there's no intensive outpatient service in that part of the state, and there's a need for more IOPs, et cetera. So really, part of what we do is that behind-the-scenes work helping improve the whole landscape of care. Some of you may be familiar with ASAM, the American Society of Addiction Medicine. That is the gold standard in the field that clinicians, physicians, practitioners use to assess what level of care a patient or consumer needs. ASAM worked with us to put an embedded assessment on our locator. So in very easy layperson terms, somebody can go through this assessment and thereby understand what might be a good level of care for their needs. That doesn't replace a full clinical assessment at a treatment provider, but it helps people understand what might be a good fit for them. And that's really important because so many people think everybody needs a 30, 60, 90-day residential program. And that can be scary for some people if they think they might lose their job or somebody might take their children away. And not everybody needs that level of care. So we're really happy that ASAM worked with us and that we have that embedded assessment tool. We have two sources of data that make Atlas work. One is the treatment facility survey, and that's the data that all the treatment providers send to us. We have a really good response rate in Wisconsin with providers giving us that data. And when we do the demo, you'll see how robust that information is when providers give that to us. And that's really so the consumer can see everything that's offered and then they can make their best healthcare decision. If a facility doesn't provide that to us, they're still listed because we want everybody to understand all the resources available. But without a facility giving us the data, they would be listed with no data known about them, and that's not the experience we want for consumers, obviously. So we encourage providers to submit that to us. The second source of data that we put on our site, which is really different than other things out there, is we have a patient experience survey. And that's where patients or consumers or their loved ones can leave reviews about facilities. That's really important to us because over 70% of human beings want to know what others think of a facility before they make their own healthcare decision. So we will be pushing pretty hard for more patient experience surveys to come in starting in about July. Something else that is unique about Atlas, when Mr. Mendell was starting this initiative, it was very apparent to him that there was no uniform set of quality metrics to measure substance use providers by. So coming out of the Surgeon General's report in 2016, here's a list of quality metrics that we developed. So things like everyone having a personal plan, having fast access to care, things like that. And we didn't develop these in isolation. We worked with lots of reputable organizations to make sure that these quality metrics were solid. So every facility that submits data to us also has their quality metrics online, and that is a really important part of how a person or their family can understand what level of quality is happening at that facility. And as we were developing the quality metrics, which we call the principles of care, we had many health insurers also endorse them, covering many millions of lives. So we've had a lot of support, a lot of collaboration from experts in the field as we develop these things. And we've talked about the patient experience survey a little bit already, but we will be really putting an emphasis on this starting shortly. And here's an example of the professional portal. Again, the state can see everything. They can see gaps in care, how high the quality metrics are statewide, and providers can only see their own data, but compared to every other provider in the state. So they can see how they stack up and see where they maybe need to make some improvements or offer more care to people. And as mentioned earlier, so we're launching here today. We're launching in 2 more states in September. And at that point, we will be able to help almost 50% of the US population find help. So we're really excited about that expansion. And then we're going to move to a demo. Any questions while we're getting set up for the demo?
When you say state, who usually has the access to that, like state unit?
Oh, so our state partners at the Department of Health or Family Services, it varies state by state. Okay. So here's the live site, and Wisconsin is live. So right here at the front page, we offer encouraging videos, as you can see, and we make it real easy to begin searching for treatment. So I'm going to put in a central Wisconsin city. And then right away, we see that we can look for all the centers near that geo area, or we can get help choosing. I'm going to pick this option for the purpose of the demo. So here we begin with the ASAM assessment tool. And if we have any clinicians online or in the room, this should look really familiar in how it maps to the ASAM dimensions. And I'll just pick some options for the demo here. And at any time, so we offer encouragement along the way, but at any time, if somebody doesn't want to do this, they can skip a question or just see their results so far. I'm going to finish the ASAM assessment just for the purposes of this. We ask about things that somebody might be needing, not only what they're struggling with. We ask if there's a legal requirement, is this mandated? And how ready someone is for help. And so based on what I selected, the ASAM assessment tool is saying that a hospital inpatient program might be the best fit for this person. And of course, if I had answered differently, it might say an outpatient program might be the best fit. And then what it does, it shows the filters I've selected on the left side, right? So these are the things I entered based on what I've clicked on so far. And then it pops up options. And you can see these green check marks mean that for everything I've entered as a need or something I'm struggling with, the green check marks mean that this facility meets all of those things. And, you know, not a shocker to those of you in Wisconsin, especially in rural areas, we have to drive to get to things. And if we go down further, so the top of the search will show the things that match the patient's needs, plus would be the closest in proximity. And then as we get farther down, things would be farther away and sometimes have X's if the facility didn't offer some of those things. This is really unique because actually everything rendered in this search meets every one of the person's needs. Usually we find that there are some gaps in care. But so that's how that works. And let's look at a card for Rogers Memorial, just to show you what it looks like. So if I was doing this on a phone, I could call the facility right from here. I could reach out for help through this as well. So facilities let us know how they want to be contacted, and we can track on referrals to them through Atlas, which is something important for providers to understand, is the referrals that come through this. Then it talks about how we compare to the selections that that person made. There's payment information. We can search by the insurance somebody has. And then we see those quality metrics. And this is a great example of a facility that's meeting all of the quality metrics. If they weren't meeting all of the quality metrics, these would be grayed out or partially shaded. But this is an example of a facility that's meeting all of the quality metrics. And it's right here for somebody to see and understand. This is that patient review if people or their loved ones want to leave a review about how their experience was. And then we have even more information we can see about the facility. And so this is the information we gather from the treatment facility survey. So you can see how important it is that they give us that data so we can populate all of these fields for people to see and make a healthcare decision. And we see special populations that are served, evidence-based practices that they have there. Right down to even what medications they prescribe. That's important to some people if they're especially needing a certain type of medication-assisted treatment or MAT. The evidence-based therapies. So let me stop there. I think we're close to time, maybe over a couple minutes, but I want to save time for questions. Yes?
So it doesn't appear to be available now, but as the platform grows and potentially you get, all of the states covered, would there ever be a way to add availability or beds available at the center? I would struggle with that with my daughter. I would spend all day working on admission to this facility only to know that bed got filled and I missed 2 beds at another facility, or 2 other facilities. Would there ever be a live feature like that that could be added so that people know what if they are accepting?
Yes, it's a great question, and that is a huge deal to know where there's bed availability versus a 2-month waiting list. And so that is an enhancement we're looking into. Yeah.
I saw you had insurance on there, but as you went through, there was no cost. Is that based on the insurance that you have or don't have, or how do you?
Yeah. Yeah, exactly. So that would be based on the insurance somebody has, and then all those things we all have to deal with, like have we met our deductibles, what's covered, et cetera. But that's definitely a search feature. So here on this card, I can see all the insurances that this provider accepts. But if I went back to a previous screen, I could actually search by the insurance I do have and do my search that way to pull up all the providers that take my insurance.
And I'm assuming there is a cost to the person.
I'm not sure that that's always the case, that there's a cost. I think it depends on the insurance somebody has or the funding at a facility. Yeah. Any other questions or online questions? Yes.
That's a lot of information provided for the providers, and I'm just wondering if there has been any pushback on people wanting to provide you with that information, or I don't know. It just seems like it would be a lot of work and overtaxed employees already at
Yeah.
the treatment facility.
Yeah, so the question is, has there been pushback from providers? Is it a lot of work? So we do try to provide helpful information about what to gather so that when somebody does the survey, it can be an efficient process, because if you don't have everything ready at your fingertips, it will take longer. So we try to provide help in that way, and our team will get online with people and walk them through things. But it does take up to 2 hours the first time, but after that, about every 18 months, we ask providers to go online and let us know if services are still accurate, if they need to change anything, and that only takes about 15 minutes. Any other questions? Yes.
And you're constantly working with providers now in state, right? So this will just keep growing and growing as more decide to join your facility.
Yes, we will keep adding facility information. So whenever a new facility opens up and gets licensed, we'll get that information and add them. And if unfortunately a location closes or is no longer licensed for some reason, we would remove them from our site. And then we want to encourage facilities to keep submitting that facility data so that the majority have data online, rather than the no data known. So they'll still be listed, but we would like all that data for people to see and understand. Okay, anything else? Thank you so much for being here.
Thank you.